Hello everyone, in this video we will discuss about the anatomy of the pelvis and the acetabulum. So to begin with, we will cover the bony anatomy. So in bones we have the two hip bones which articulate posteriorly with the sacrum bone, and they articulate anteriorly with each other to form the pubic symphysis, and posteriorly we have the two sacroiliac joint. In hip bone we have three parts. We have the ilium, we have the ischium, and we have the pubis bone. Other parts of the hip bones are we have the iliac crest here, we have the anterior superior iliac spine, we have the anterior inferior iliac spine, we have the iliopectineal eminence, we have the iliopectineal line or arcuate line, we have the pubic tubercle, and we have the pubic symphysis. And we have the superior and the inferior pubic rami. Posteriorly we have a ischium bone here, we have the ischial spine, and we have the posterior superior iliac spine and the posterior inferior iliac spine. So posteriorly we have this notch known as the greater sciatic notch, and this is known as the lesser sciatic notch. So all three bones, ilium, ischium and the pubis, they converge together to form the acetabulum, which is a horseshoe shaped structure which further articulates with the head of femur to form the hip joint. So in sacrum we have this. So sacrum is basically formed by the 5 sacral vertebrae. We have S1, S2, S3, S4 and S5. They are all fused together. In sacrum, this is the S1 vertebra. This anterior part is known as the sacral promontory, and these are the two wings known as the sacral ala. We have the transverse process of the sacrum. We have the superior facets of the sacrum. So these facets, they articulate with the L5 vertebra, forming the L5-S1 joint. And also we have, these are the posterior sacral foramina. These are the 4 posterior sacral foramina, and we have 4 anterior sacral foramina. And we have this vertebral canal through which the dura and the spinal nerves they pass. Then we have the sacral hiatus, which is also used for the caudal epidural blocks. And inferiorly we have this tailbone, which is coccyx, which is fusion of 3 to 4 coccygeal vertebrae. So in acetabulum is a horseshoe shaped structure which has the anterior wall anteriorly, we have the posterior wall posteriorly, and we have a dome of acetabulum. So there are concept of columns in acetabulum. We have the anterior and the posterior column. Anterior column is basically formed by the anterior half of the ilium. We have the anterior wall, we have the superior pubic rami and the pubic bone. And posterior column is basically formed by and it starts from the greater sciatic notch. We have the posterior wall, and we have the ischium, which is the main part of the posterior column. Talking about the ligaments, we have the anterior, we have the pubic symphysis, which has the superior and the inferior pubic symphysial ligament. At the sacroiliac joint, we have the anterior sacroiliac ligament. We have the inguinal ligament, which starts from the anterior superior iliac spine to the pubic tubercle. Then posteriorly we have the important ligament. We have the sacrospinous ligament, which starts from the sacrum to the ischial spine, and we have the sacrotuberous ligament, which starts from the sacrum to the ischial tuberosity. These two ligaments, they forms the greater sciatic foramina and the lesser sciatic foramina. Then posteriorly we have the posterior sacroiliac ligament. Then we have the iliolumbar ligament, which starts from the ilium to the transverse process of the L5 vertebra, which sits up over the S1 vertebra. So we have the iliolumbar ligament on the both sides. Now coming about to the muscular anatomy, the muscles in this region, we have the iliacus muscle, which forms the inner part of the false pelvis. So a pelvis is divided into two and a false pelvis. So this is the false pelvis, which is the outer part of the or superficial part of the pelvis, and after the pelvic brim, here we have the beginning of the true pelvis, which has the pelvic organs which lie here in this part, and above the pelvic brim we have the false pelvis here. So iliacus muscle, it forms the inner part of the ilium bone. Then we have the origin of from the anterior superior iliac spine, we have the origin of the sartorius muscle. We have a part of origin of the rectus femoris from the anterior inferior iliac spine. We have the origin of the adductor muscles from the pubis, and we have the origin of the hamstring muscle from the ischium. And then coming upon to the posterior part, we have the gluteal muscles, which we have a gluteus maximi, we have the gluteus medius and the gluteus minimi muscle, which forms the posterior muscular anatomy of the pelvis. Now the vessels, important vessels in this region, we have the common iliac artery, which divides into the external iliac and the internal iliac artery, and the branches of the external iliac artery and then the obturator branch of the internal iliac artery, they anastomose each other to form the corona mortis. So corona mortis is basically anastomosis between the external and the obturator branch of the internal iliac artery. So it lies roughly about 6 to 7 centimeter from the pubic symphysis. And then posteriorly we have the superior gluteal artery, which lies here in this region of the greater sciatic notch. So it is very commonly injured in the posterior column fractures, and also it can be injured iatrogenically, while the reduction of the posterior column fractures in the this greater sciatic notch. And then coming to the nerves in this region. So very important nerve is lies in the greater sciatic notch is the sciatic nerve. So it comes out from the greater sciatic notch and runs on the posterior part of the ischium. So it lies anterior to the piriformis muscle and it lies posterior to the other external rotators here in this region. And other nerve which is important and which is encountered in the anterior intrapelvic approach is the obturator nerve, which passes along with the obturator vessels and then passes through the obturator foramina to supply the adductor muscle. So this is all about the bony, muscular, neurovascular anatomy, which is important from the surgical orthopedic point of view of pelvis and the acetabulum. Thank you.